Hi, Facebook Live. My name is Jen Brunsman. I'm a nurse here at Finley ER, and I'm here today to talk to you about both our ER and our brand new cath lab. There's a couple things that I want to discuss with you. Specifically, we're going to be discussing today heart attacks and heart attack symptoms. Before you would come to me, you would obviously have some kind of symptom. The one that we always think about, the quintessential, is going to be chest pain. However, heart attacks can be a little bit trickier than that. Sometimes a heart attack comes on as nausea, vomiting, shortness of breath, even a pounding of the heart kind of symptom. Whenever you have these kinds of things, I want to really emphasize the importance of calling 911. Time is muscle. If you can get to us as quickly as possible, then we can help you to the absolute max of our ability. When you call EMS, you call 911, you're going to be discussing with them your symptoms and everything else, and they will transport you here. This is our ambulance bay in which they will bring you to. They will be doing IVs, they'll be doing EKGs, they'll be doing all of the stuff that we need them to do before you get to us. Because the faster you can have things done in the field, the better we can help you here. When they do call, we'll be calling what's called a code STEMI. STEMI is just a fancy word for heart attack, or someone with heart attack-like symptoms. When we do, you will be seeing an ER nurse that will come to one of our lovely ER rooms. This is our Trauma Bay 1. This is one of 16 rooms in our brand new ER that I'm sure you've all seen go up in Dubuque here. When you come here, the ER nurse will be waiting for you, and we will be doing all the rest of your labs and x-rays and everything. When they built this place, they built it very intelligently that they have both an x-ray wing right there that's all part of our ER. Then we will be going straight up to your cath lab where we get to see one of these lovely faces. This is Andrea. She is our cath lab manager, and she will be telling you more about the cath lab and what we can expect once you get there.
Hi, Facebook. At this point, we're going to be going up to the cath lab. We're going to be taking the ER with us. Also, your family is going to be with us. We're going to be asking you a lot of questions, asking if you have any pain, answering any questions that your family may have, and talking with the ER and what your treatment was prior to you getting to our facility.
One of the main focuses for us when you're here with us at Finley is to make sure that you're comfortable and that you're well informed. So we will be communicating, like EMS communicated with us, we will be communicating with cath lab to let them know exactly what to expect and exactly where you're going to be going and how you're going to be treated. Main thing is that we get you well better.
Our priority right now is to get you into that cath lab and get that vessel open in our less than 90 minutes. Our goal is less than 60 minutes. So in the hallway here, we say goodbye to our lovely ER staff, and my staff would take your family to our waiting room to wait until the physician was done and out and talking with them after the procedure. Right at the cath lab doors, you'll notice there's a red line area. What that symbolizes is that it's a sterile procedural area. You'll see everybody dressed in hospital scrubs with bonnets on, just so you know what to expect when you come in. We'll come in. It's a cold area. We have to keep it that way because our machine is very sensitive to humidity and heat, so we want to make sure it's in good, proper working order for you. There are 4 staff members, 2 rad techs and 2 nurses that'll be with you the entire time. You're the only patient in the room, so you'll have plenty of one-on-one care. We'll move you over to the table. We come at you very quickly. That is not something to be alarmed about. We affectionately call ourselves a pit crew because we're moving so quickly. We get you hooked up to all the monitoring, so an EKG, a blood pressure cuff, an oxygen saturation. We put oxygen on you. We're talking to you the entire time. If you're nervous or in pain, please let us know. We want to make sure that you're comfortable while you're with us. We clean off the area that we decide to, whichever site we decide to go into for the procedure. We can do radial approach, which is going through your wrist, or we can do the artery through your groin. We'll shave any hair that is in the way, and we sterile prep it with sterile soap. After that's done, we put a sterile drape on you. It's blue. At that point, everything on top of you is going to be sterile. So it'll be very important to leave your hands flat to your sides and your legs flat down, and keep your head on the pillow. Once that's all done, we call the physician. He comes in and he'll give you some numbing medication. It's called lidocaine. It's very similar to what we use in the at the dentist's office to numb the location. After that, it feels like a bee sting. After that, you shouldn't feel any pain at all. But again, if you do feel pain, please let us know. We want you to be comfortable. You'll see the machine here. This is what is responsible for taking pictures. It moves all around you. It won't hit you, but it does get pretty close to you. We are taking 3D images of a 2D images of a three-dimensional object. So we have to move all around to make sure the vessel looks good at every angle. Right there, you can see that is an actual image of a coronary artery, and so that's what we're looking at. We're looking for the contrast to flow through the entire artery. We were looking for any type of pinching of that artery or the artery be completely blocked. All the catheters go through the artery, the access site the doctor chooses, again, whether it be groin or radial. That monitor also shows the doctor all of your vital signs. It can freeze images so he can use them for further reference. And once those images are obtained, then you can choose the course of action, whether it be a stent or a balloon, or how we're going to best take care of that vessel and open it back up. You are hooked up to all of the equipment to make sure that you're in good, stable condition during the case. Along this wall right here, you'll see all of our stents and balloons and our wires and catheters. We want to make sure that all of our supplies are easily accessible and right here, ready at our hands for doctor. Right behind you, there is a sterile table. We can show it. When we are in a case, this is opened. There's a blue drape on it, and all of the doctor's tools and equipment are on this table, ready for him to be able to get to. Like I said, the staff that's in here, there are 3 in here actually, and 1 in the monitor booth back in the back. They are monitoring the entire case, so there's a lot of two-way communication going on, but not to worry, we're all right here in case you need us. After the case is over, the doctor will go out and talk to your family and let them know how you did, and then you'll be taken to a private room for you to able to recover in nice private area. So we will come back out here. We want to thank you for joining us today. We hope you learned some valuable information. Time is muscle, so please, if you're experiencing any heart attack symptoms, call 911. Don't drive yourself, and we hope to not see you.